Good afternoon. So we are now looking at the male and female reproductive system. So this is introduction to those two systems. So discuss these two systems separate from each other. But today's discussion just focuses on the external parts. Then later on, we'll look at them in more details, both the male and the female reproductive. So we'll start with the male external genitalia. So whenever you hear the term genitalia in anatomy and physiology, it refers to a part of the reproductive system. So both males and females have parts of the reproductive system that are visible to the external environment and those that are not visible. So those that we can see, we call them internal genitalia or simply internal reproductive organs. Those that we can see, we call them external genitalia or external reproductive organs. So here we can see the male external genitalia. So it is composed of the following structures. So the first organ is the penis. You can see there, that is the penis. Then underneath is the scrotum. What is inside are the testes. So you can't see testes, but you can palpate for them. You can feel them in the skin there. So the scrotum is a sac where the testes are found. So these organs, the testes, develop in the abdomen. Now, in the abdomen, the temperature is so high. Okay, the core body temperature is about 37 degrees Celsius. In the abdomen, in the rectum, and other internal cavities, you find that that temperature is even slightly higher, 37.5, and so on. Now, the testes and the ovaries cannot stand that temperature. Worse is the testes. So the testes completely exit the internal environment of the body. That's why they're located on the external surface. The ovaries run away from the abdomen as well, but they don't completely leave the body. So they remain stuck in the pelvis where the temperature is slightly lower, but ovaries, unlike testes, can withstand high temperatures. So if testes remain in the abdomen, then the cells there are damaged. Those are non-functional testes. Okay, testes must leave. So the only way the testes can survive is to be exposed to temperatures that are below the core body temperature. Okay, so that is number one, the two organs, penis and scrotum. So let's look at some detailed features of the penis. So penis has the following parts. The bulb, that is the bulb you can see here, the origin of the penis. Then there's a shaft, which is the midsection or the mid part of the penis. Then there's a tip of the penis known as a glans penis. Besides the bulb, we have two muscles. These muscles are known as crus muscles, or we can simply say crura for plural. So one is known as a crus, that is C-R-U-S. So you have left and right crus muscles, or we can simply say the crura. So those serve as the root of the penis. So the penis is attached to bone, which is a pelvic bone on the anterior surface there. Begins as muscle, then finally ends as erectile tissue. So the muscle only ends here at the level of the bulb. The shaft, the glans penis, has no muscle. So the penis is not a muscle. It's just erectile tissue with a lot of blood vessels that becomes hardened after an erection. Let's look at parts that make up the penis. So those are just divisions: the glans penis, the shaft, the bulb, and the crus. Now we have erectile tissues in the shaft of the penis. We call them bodies or simply corpus. So the penis has three corpus or three bodies. Two superior, like you can see those, that is the right and left corpus cavernosum. So one is cavernosum, both is cavernosa. So this is Latin. Latin, SA is plural. UM or US is singular. So these are the corpus spongosum, the two of them. These are the erectile tissue. When the penis is erect, these two tissues are filled with blood. Then underneath is a corpus spongosum. Spongosum means sponge. So it's called sponge because this is where the urethra passes through. And you know that urethra connects or transports urine from the bladder to the external environment. So that is a corpus spongosum and the corpus cavernosum, left and right, together known as corpus cavernosa. Now, I want you to observe that the glans penis is formed by the corpus spongosum, the one which is inferior, the one which is below here. That is a corpus spongosum. It makes the tip or the glans penis. So the glans penis is nothing but a swollen distal end of the penis. Then the glans penis has a space in which the corpus cavernosa fits in. So these two are attached there to form now a single organ known as the penis. Okay. So they are held or wrapped around by tough connective tissue known as Bark's fascia. So the Bark's fascia surrounds the three erectile tissues, that is corpus spongosum, left and right, and corpus cavernosa. Corpus cavernosa, left and right, and corpus spongosum, which is just singular at the bottom there. Unless some disease occurs where the connective tissue is removed, that's when the three tissues can separate from each other. In rare cases, if you work from the surgical department, you find patients who have what we call penile fracture. Penile fracture occurs when the corpus cavernosa, comes out of the connective tissue that covers it, and then the tissue is damaged. So the blood vessels there are not pumping blood correctly, and therefore erection cannot be sustained. Okay. In most cases, that may lead into amputation of the penis. Very rare problem there, but it has been reported even among adults during intimate activities. So those are the parts of the penis. Three erectile tissues. Now, again, I want you to observe that the root of the penis has nothing to do with the corpus spongosum. The root of the penis is attached to the corpus cavernosum. Okay. And you see that this goes into the bone, the pelvic bone there. So to some extent, these muscles, because they are skeletal muscles, if you try to constrict them, that is males, you may feel some slight movement in the penis. But when the penis is erect, these muscles plus the corpus cavernosa help in the process of copulation, or what we call reproduction. So those are the three parts that make up the penis. Okay. So testis, we'll look at it more in details when we start looking at internal organs of the reproductive system. But a quick and brief introduction is that we have two testes, left and right testes. Okay. Of the two, the left testis lies a bit inferior compared to the right testis. So you see that the right testis will be hanging a bit higher, whereas the left testis seems to be hanging lower than the right testis. This is normal in all males on average. Okay, it's rare that it's a right testis that is found to be hanging lower, but that has no effect on fertility or reproduction. It's just a normal arrangement of the human body. So one testis reaches at the far end of the scrotum, whereas the other one seems to be a bit higher. So it is the left one that hangs a bit lower. Now, testis has anterior surface. So you can see this. This is a part of the testis that faces all the time in front. Then at the back, we call it a posterior surface. At the posterior surface of the testis, we have another small gland known as the epididymis. This is where mature sperm cells are stored. Now, if you observe, the testis is large, the epididymis is small. Okay. So the production site for sperm cells is the testis. The storage site, like a warehouse where mature sperm cells are stored, is the epididymis. So it's not like sperm cells are produced there and then when you need them. They are stored, waiting for the cells to be released during the process of reproduction. During ejaculation, the mature cells leave the epididymis and then are ejected through the urethra into the female reproductive tract, which is the vagina. So that is testis, anterior pore or anterior surface. And this is a posterior surface where we have a small gland known as epididymis. Next is that the testis has superior and inferior pore. So this part is superior pore. This part is inferior pore. Inferior pore, superior pore. So blood vessels enter the testis from the posterior surface, from the back. So they are protected because in front there, you find that when you are sitting, so many things can occur and cause injury. So that's why the vessels are always located at the back of the testes. Okay. So we'll look at this in greater details, but so far, this is the testis. What makes up the testis so special in that it produces sperm cells? So each testis has about 2 million tubes. These tubes are lined with a special type of epithelium. This epithelium continuously produces cells throughout the life of a man. So that's what we are seeing here. These coiled, highly coiled tubes, we call these as seminiferous tubes. So these seminiferous tubes form lobes. So this is one lobe, another lobe, another lobe. So each lobe has about 2 to 4 seminiferous tubes. So you can see here 1, 2, 1, 2, 1, 2. Now this tube is highly folded. So if it was to be stretched to see how long the tube is, it would be actually even be longer than the height of an individual whose testis is being examined. So it's a highly coiled tube, and the cells there are producing sperm cells. So that's why a man produces sperm cells for life. There is no menopause unless otherwise. It's very rare that menopause has been reported in men where they can no longer produce sperm cells. The number of cells, yes, can drop, but still that man is having a lot of mature cells and can impregnate even at 100 years or more than that. Quite different from our female folk, where they run out of cells. So females, they already come with a finite number of cells. And these cells, once they run out, there's no more any structure in the body of a female that can produce new cells. So we find that in a lifetime, a woman will ovulate about 500 cells, more or less. Others can be 480 something, others can be 520 plus, but that's the average. So if you split it in half, you can say 250 for each ovary. The left ovary in a lifetime of a woman will ovulate about 250 cells. The left one also 250 cells. Then out of those, chances are that some will be fertilized and you and I are now born out of that process. So that's the male reproductive system. There isn't so much. Here again, we are seeing the section through the penis. We are seeing the 2 corpus cavernosa, which are erectile tissue, and there's corpus spongosa, through which the urethra passes to the external environment. Okay, so I'll be quick. We look at the female external genitalia. So female external genitalia is also known as a vulva. So the part of the female reproductive system that you can see with the naked eye is known as the vulva, or you can simply call it the pudendum. Same thing. So all this area you're seeing here is known as the vulva. What structures are there? About 8. So number 1 is the mons pubis. Mons pubis, this is the area just above, or we can say below the umbilicus, the navel, or the belly button as we call it. And that area is specialized in females for storage of fat. We don't see that in males. Okay, with time, there can be some fat, but for females, you see that that area is specialized for storage of fat. And that fat is essential when the woman becomes pregnant, because they will need energy not only for themselves, but for the fetus that is growing in their uterus. So you see that the pelvic area of a female is specialized for fat storage. That's why if you compare the size of the pelvis in man and woman, they're not always the same. There must be enough room for fat and muscle in preparation for child bearing. So the mons pubis is always surrounded by hair, and this hair covers not only the mons pubis, but also covers the labia majora. So this is skin. Mons pubis is covered in skin. Labia majora also covered in skin. And you find hair there. Okay. Then between the two labia majoras, that is labia majora, left and right, we find the labia minora. So the space between the two labia majoras, we call it the vestibule. I was saying the whole female external genitalia, we call it pudendum or vulva. Now, to be specific, the space between the two labia majora, we call it the vestibule. So that's where we find the labia minora. So different from the labia majora, labia minora are not skin. This is membrane, mucous membranes. If you remember, we had stratified squamous epithelium. So there's no hair on the labia minora, as you can see. So labia simply means lip in Latin. So we have large lips, that's what you call the labia majora. Small lips, that's what we call the labia minora. Okay, now the labia minora at the superior pole here, you see that it covers a very special structure in females that is similar to the male penis. That is called the clitoris. So the clitoris is covered by the labia minora. So in terms of structure, the clitoris is almost the same as the penis. I think I have a diagram showing, if you compare this structure, similar to what you saw with the penis. Penis had the glans penis. Here now we are calling it glans clitoris. Then penis had body or the shaft. Here we are calling it the body or the shaft of the clitoris. The penis had the two crus muscles or the crura muscles. Equally, the clitoris has those two crus muscles. So even though what we see is just the tip of the clitoris, which is the glans clitoris, the larger part of it is hidden under the labia minora and labia majora. So it's not a small organ at all. It's actually a very large organ, except the whole lot of it is covered under other tissue. Now, of all these parts of the clitoris, it's only the glans clitoris that has nerves in them. So it is the most sensitive part of the clitoris. But in most cases, when people say clitoris, they're just referring to the glans clitoris and ignoring the other parts. But now, you and I will know that this organ is actually large and similar to the male penis. Actually, the origin is the same. They come from the same origin. Okay. Then further, within the vestibule, you find the vaginal opening. So it's called the vaginal orifice. So that is the vaginal orifice, covered with membrane. Okay, that membrane is known as hymen. Now, this membrane is only present in female who is not sexually active. Like children, you find the membrane covering the opening of the vagina, and only a small perforation can be present, or it can be completely sealed. Okay. In adults, when you're examining the vaginal opening, what you find is not the hymen, especially if someone is sexually active. What you find are the remnants, the remainder of what was there. We call them the hymen caruncle. So those are hymen caruncles, more like rugged edges of what was previously the hymen. Next is the two commissures now. So we have anterior commissure and posterior commissure. So anterior commissure is here. Anterior commissure connects the labia majora above here, and then the posterior commissure connects the labia minora posteriorly there. So in terms of the two, the anterior commissure is well developed because you can see where the labia minora, the labia majora left and right is meeting, but the posterior commissure, you can't clearly see where the two are meeting. So it's not well defined. Then within the hymen caruncle, you see small openings, left and right. Those are opening to the Bartholin's glands, or what we call the greater vestibule glands. So the glands, the labia majora, appears swollen, you know, like there's something underneath. And for real, there's glands underneath it. So those glands, we call them the greater vestibule gland, or simply the Bartholin's glands. You can see them here in purple. These are the Bartholin's glands. Now, Bartholin's glands are stimulated mainly by the sympathetic nervous system. Okay, when a woman gets sexually excited, that's when these glands produce some serous and mucus secretion in readiness for reproduction or coitus, as you like it. Then as a woman ages, those glands reduce in size, and therefore lubrication also is affected, and you find that coitus can be painful at that age. But as long as this person is still young, the glands will still be able to offer lubrication. This is essential because in the vagina, there are no glands. The vagina has no glands for itself. So even if the woman is stimulated sexually, there will be no secretion from the vagina. To prevent cracking, injury, bruising, and the rest, that's why the greater vestibule glands are present. So you can see those small perforations left and right. We call them ducts of the greater vestibule glands, or simply ducts of the Bartholin's gland. Lastly is this small opening here, just underneath the clitoris, the head of the clitoris. That is a urethra. So urethra is superior to the vaginal opening and is also anterior to the vaginal opening. Okay. So that is the external urethra, meatus, or orifice, if you like. Then finally, now we look at the space between the vulva and the anus. This space in both males and females is called the perineum. That is, a perineum is triangular in shape. Okay. Underneath this area, there is a small, dense area of connective tissue known as a perineal body. So muscles attach into that structure, the perineal body. I want to show you. Yeah, you can see that grayish structure there. You see this muscle and that muscle going into it. Muscles around the vaginal opening, muscles around the anal opening, all of them are going there. In labor, this area is important in women because if there's difficult labor where, for example, this child or the fetus that is about to be born is having a larger head, you tend to incise. You get a scalpel and cut into this area, the perineal body. You make a deep incision. These muscles will become loose, and therefore the birth canal widens, and you'll be able to deliver that child. So the child can be born without any difficulties. Previously, it was mandatory. All women in labor, you have to get this procedure known as episiotomy, but now it's only done in special cases. So that's a application. When episiotomies are done, it's simply incision into the perineal body to relax the muscles of the birth canal. Okay. So I've actually exhausted most of these structures that we mentioned, found in the male and female external genitalia. Now I want to show you the origin of the male and female reproductive, external and internal reproductive system. So once fertilization occurs, ovum and sperm meet, a zygote is formed. The zygote implants in the uterus, and from there, a human being begins to develop. Okay. Now, around 21st day of life, all the way to 30th day of pregnancy, there are two tubes that form in the growing fetus. We call them the paramesonephric duct, or easily remembered as the Mullerian duct. There's also a mesonephric duct, or easily remembered as Wolffian duct. So there are two ducts, Wolffian ducts and Mullerian duct. So whether the fetus is male or female, they're going to have these two tubes. At this stage, the body doesn't know whether it is male or female. Okay. Now, depending on the genetic makeup, whether you have X and X or X and Y, one of the ducts will die to allow the other duct to dominate and therefore define the gender of this human being. For example, if this is male, the blue duct, which is a Mullerian duct, will degenerate. It will not grow. Because if this duct grows, it will give us female reproductive organs. If the fetus is female, the Wolffian duct, which is male, should die and allow the Mullerian duct to progress and develop and give us female reproductive organs. Now, in some individuals or babies, you find that there's a problem that occurs during the process of development where one duct doesn't die completely. What you're going to get now is an individual with what we call ambiguous genitalia. Ambiguous genitalia is where it's difficult now to identify by examining the genitals, whether this person is woman or man. Why? Because one of the duct did not die completely. So the male duct, we call it the Wolffian duct. The female duct, we call it the Mullerian duct. And one should die to allow the other to dominate and give us appropriate, reproductive organs. So it's not by design that an individual would like to be born like that. It's just nature that has failed to complete the processes where one duct should die down. So let's quickly look at this diagram. So here on your right, you have a male reproductive system, on the left, female. So you can see that the Wolffian duct, which is male, has given us all these structures of the male reproductive organ, whereas the Mullerian duct, which is female, has given us all these reproductive organs, which are female. And now I was saying, in an event that one of these tubes does not die completely, that's when you have what we call ambiguous genitalia, where it's difficult to ascertain the gender of that child by examining their reproductive system. So they will have, a penis somewhere and an opening that looks like a vagina, and really very difficult to determine. So you do hormonal tests, you see which hormones are dominant, such kind of tests, to determine now completely say this person is male or this person is female. And usually such cases, you find that that person is, not sterile, not fertile to some extent because of that mixture of reproductive organs. Again, I was saying that is not by choice. These are things that can happen to anyone. And really, science has not yet come up with solutions. How do you reverse this process and then allow someone to live like male or female? It's quite difficult because the organs are present there and then at birth. So really what you follow now is to see which organ is dominant. Okay. And then other issues can come in, which science has no control over. It now is issue of society, gender and all those things. But anyway, that's what I had for you. That is the external reproductive parts. In the next session, we'll start now looking at them one by one and in greater details, starting with either the male or the female reproductive system. Again, in case you have any answers or questions, just reach out to me. I'll be able to respond accordingly. So we end here for today.